Um, I guess my current experience with the New York City healthcare system hasn't always been the best.
It sucks to see your family members not be able to get any healthcare when they need it, or to have to pay medical bills just for going to the hospital once because they felt sick.
But like my aunts, my cousins, family, friends, have that privilege. And directly that's not my problem, but indirectly I would say is because those are people that are very close to me. They're family, of course, close friends, and it really hurts seeing them have to struggle just to get decent health care.
My mom, for example, she's diabetic and like she gets sick a lot. So like, and sometimes it's like she goes to the hospital for like a couple of nights, and when she comes back, she has to deal with so many bills. And I feel like what should be done about it should find a way to help everyone get the Medicare they need, because we all pay taxes and based on our income, and it shouldn't be fair that others get an advantage towards it.
The Black population has probably had the highest percentage death rate in the country. And that's probably because, number one, it has the highest percentage of people who are uninsured and or who lost their insurance.
And even just like accessing like health coverage like has been super difficult to like navigate, especially now as like a working adult. Like understanding like what specific benefits mean, or even like when I didn't have like health benefits like through my employer and I had to do it through New York State, like that was also difficult because I felt like I was paying a lot more than I actually was making on like a part-time salary.
I'm not knowledgeable about the situation. I can admit that I haven't read much about it, but I've done my fair share of reading, you could say. I know it's a big problem that's affected multiple people, persons of colors, like communities, POCs, and I know that it's something we have to tackle because I just recently the CDC just declared racism as a health issue, and that's the first step we can take as a country and as a globe to tackle this issue.
It's really important to realize how unequal it has been for everyone, and whether that be because of their ethnicity or race or sexual and gender identity. And so race does play a huge role because we know that minorities have not been given equal care.
I think it's been difficult, like even when I'm at a clinic, like getting my yearly checkups. I think it's sometimes hard as like a non-binary person of color to feel like validated in some of those spaces where sometimes like my doctors like misgender me, or sometimes they don't really take as seriously like what I'm feeling. And I think that's super true for a lot of like people of color, and also for folks who are like on the queer and trans spectrum.
Learn more about it. Read more about it.